Welcome to Mind Tricks Radio, where we'll explore contemporary topics in psychology through interviewing creative and innovative thinkers in the field. I'm your host, Dr. Aaron Kaplan. Thanks for tuning in. We're here today with Dr. Sarah Sarkis, a psychologist, writer, and performance consultant with a private practice in Honolulu, Hawaii. Her integrated approach is big on science and low on BS, empowering her clients to achieve long-term change and growth through an eclectic blend of psychology, neurobiology, and functional medicine. Her blog, The Padded Room, is your virtual safe space to help you manage the jarring realities of life. You can find it at drsarahsarkis.com. You can also follow her monthly essay series, Shrink Wrap, via her work with the Flow Research Collective. Sarah, welcome to the show.
Thanks for having me back.
Sure. And you were here, it was a few months ago, you were here talking about the interesting topic of the power of the unconscious.
My favorite.
Yeah, and
Yes.
that's been a very popular episode. So thank you very much for coming in and talking about that and coming back today.
Yeah, we planted the seed. Any listener that listened back then, you'll know what we're here to talk about because we gave you forewarning.
Yes, and I've had actually several people say that they were excited to have this episode. So thanks again for coming in.
We have something to live up to.
Tell me a little bit first off about your interest in this topic of defense mechanism. What does that mean to you as a professional?
I think one of the things you pay us to do as shrinks is, I don't think the client knows that they're paying us to do this, but this is the fine print, is that we are observing what your current defense mechanisms are. And defense mechanisms are quite literally what they sound like. I write about it on my blog. I call it your personal Department of Homeland Defense. And everybody has them. For the most part, they're morally and ethically neutral. They'll sometimes perform as sort of your greatest asset, and then there's other times where that coin can flip over and it can be a liability. So this is part of the process of self-observation when awareness becomes your goal, awareness of yourself and how you operate. And one of the ways you operate is to protect yourself.
So this personal Department of Homeland Security, I think this is another Sarkisism.
I think so for sure.
That's your term.
Yes.
And why Homeland Security, though? Like you said, self-protection. What do we need to be protected from?
Yeah, and I have a funny story about this. So I made this title, and this title, looking at people's unconscious, resulted in a mass flurry of people unsubscribing from my newsletter.
Oh, no.
I guess because they saw something that I'm assuming it triggered something thinking it was political.
Oh.
And people were like, don't want to see it. And so it was very funny to see, just to get to observe that title was in and of itself self-selecting. So the reason I title it that is that your defense mechanisms operate as they are protecting you, quite literally, against feelings and sensations and emotions that were at one time in your life deemed bad, overwhelming, too intense. Sometimes these messages come through modeling. We learn in our family what are acceptable feelings, what aren't. And we both from how our parents and our siblings, if you have them, behave, and also the reaction you get from those people when you have your own emotional experiences, and you're refining it throughout a lifetime. And your defense mechanisms are a primary way in which your brain and your mind seeks to help you stay in a state of homeostasis. It's really trying to keep you balanced and feeling comfortable, with air quotes.
So these go back to childhood, family of origin, the development of these defense mechanisms, it sounds like.
Yeah, defense mechanisms are time travelers. So they travel through generations and cultures and genders, and that's just scratching the surface. But you'll see intergenerational patterns in families or cultures using certain defense mechanisms. And then, as always, there's unique qualities, right? I have a big family, but me and my siblings, we all have sort of overarching styles that are very similar, but we also have individual styles that are unique to who our own little temperament was. And, that's probably affected by birth order and all kinds of other complex things. But it's a curation over a lifetime of how you're essentially going to protect yourself. And so as a shrink, it becomes super important to look at these dynamics because you get a lot of bang for your buck. You get to see, first of all, what they're using. Once you can start to identify the defense mechanisms that somebody is using, you can also, defense mechanisms have a developmental arc. So when we talk about them, we can talk about primitive or mature, and that speaks to their developmental origin, when it's likely in the neurobiology of the child that they were capable of accessing that defense mechanism. An example is that denial and magical thinking are available to us primitively, early, whereas intellectualization and sublimation, which we can talk about later, that requires a certain cognitive and psychological development in order to use it.
So does that mean that people are developing these specific defense mechanisms if they need them at those certain points of development in their childhood?
Yeah, and I might even take out if they need them. I think we develop them and have the capacity for pretty much all of them, but our environment rules in the effective ones.
I see.
I think everybody's probably capable of intellectualization by the time they're sort of cognitively robust. We have latency age kids. I see intellectualization in a latency age kid, right? It reflects latency age development, but you see them trying to make sense of their emotional world through reason and logic. So everybody has that ability, but then the environment will rule it in. In other words, my kid will definitely use intellectualization as a defense mechanism.
And humor too, knowing your
yes,
child.
Totally.
So just going back a moment, you mentioned how defense mechanisms, there's a neutrality about them, that they're neither good nor bad.
They're neither good nor bad.
I wonder if we could expand upon that a little bit, because you're talking about it like the defense mechanisms are developed in childhood as a means of protection. That sounds kind of good. But obviously, as psychologists, we're interested in examining those defense mechanisms as if there's something there that we need to understand because they're causing some kind of a problem. So how is this neutral?
Reconcile that?
Yeah. How do we reconcile that?
Great question. What I mean when I say they're morally and ethically neutral is that, we can get into a space where we think like, oh, that's an unhealthy defense mechanism. And they're just processes that the brain and the mind does. It's true that over a lifetime, most of your defense mechanisms are going to have a life expectancy, except for a few of them. And so what I think we usually run into is that at the time that they deployed the defense mechanism, all unconsciously, see last podcast, it was helpful and it was effective. And usually we really do uncover that, like, oh, wow, that participated in saving your life, or saving your sanity, or, helping you cope. But that over a lifetime, especially when defense mechanisms are used exclusively, like you start to see somebody always using one style, so lacking a bench, really having not a lot of reserves in there. You see problems as people mature, that these more primitive defense mechanisms may not suit the complexities of what adult life requires from us. And so they just have a life expectancy. And oftentimes we're stuck in outdated patterns of coping. This is how we coped.
We could say that people may learn how to use defense mechanisms and then maybe continue to use them in their life at times in places where they don't need to, that they actually may get in the way of them accomplishing goals.
Yeah, not just goals. It may get in the way of them developing emotionally and psychologically, right? It can stunt us emotionally and psychologically because, remember, it's narrowing the aperture of the intensity of our feelings. And so the more you're relying on something that's keeping you protected from skills that you are psychologically and emotionally capable of handling now, the more atrophied they get. We have this adage in our profession. I think we've all, if you're a shrink, you've heard, like, sometimes you just let sleeping dogs lie. So, because what I don't want people to hear is that you need to now frenetically observe your defense mechanisms and strip them all down. That's not what we do.
Right.
Right.
Unless maybe you're a Buddhist monk in a cave someplace in Tibet, right?
Yeah. Well, I do think like a lot of the ayahuasca, the plant medicine ceremonies now, and like silent retreats, and they're almost a way of like sledgehammering straight in and stripping away your defense mechanisms.
I see. Interesting.
Which are so robust over a lifetime, right? I think when you've sat in our chair long enough, you have the nuance to, as the shrink, to sort of like observe and bring it up to them and help them understand like why you did it, where you do it currently. And this all happens over a stretch of time, by the way. It's not in one 50-minute session, but where you use that defense mechanism currently, and also, is it working in all areas of your life? And if it's not, what are the consequences of continuing to do it? And that happens over time.
And this is kind of what you write about in your blog about the defense mechanisms being outdated modes of self-preservation. They don't work the way that they used to, in a way that's helpful for us.
Yeah, and you can see when people get stuck, they get really stuck using these outdated patterns of, they sort of turn into forms of sabotage. They're really no longer protecting you. It's sort of like you're being tortured from the inside now.
Yeah. So you've talked about the unconscious nature of defense mechanisms. So presumably people come into therapy or they're walking around in life. They don't really realize on a conscious level that these defense mechanisms are affecting the way that they're processing and dealing with things. They developed as a child, most of them. And when they developed as a child, they weren't consciously aware that they're developing these methods of dealing with things using these defense mechanisms. They just occur.
And they were probably helpful.
And they were helpful at the time. They were adaptive.
Yeah, they were adaptive, exactly.
How does this work then for a person to come into your office or to do self-reflection and say, all right, I'm not consciously aware of these defense mechanisms, but I think I may have these defense mechanisms that are not helpful for me. They're not adaptive at this time, and I want to become aware of them and try to address them. What's that process like?
Well, the first is to observe them. Well, first is somebody's got to, you have to, usually you're going to have to show people in the hour, like, oh, do you see what just happened there? So as a therapist, you're looking to see when the defense mechanisms are employed currently in the moment that you and in the process that you and the person are going through, because it's one thing to sort of understand it theoretically, and it's another thing to have somebody be pointing out to you that it's happening in this very moment. That's probably the most effective means through which you're going to get quick buy-in.
How do you notice that as a therapist when that's happening with your patient?
Years of repetition, right? You bring up content, you see them either sort of like move away with humor, move away with intellectualization, deny it outright, turn it from pain to something positive. I mean, there's just loads of ways that people are doing this every moment of the day, right? So you're really, as a therapist, trying to pick out something our brain is really good at, is pattern recognition. If you see people doing something over and over again, and it kind of dawns on you like, oh, that's interesting. Like every time I bring up topic X, it takes this left turn, right? So then you'd bring it up. I always say, sometimes I do process, sometimes I do content. I'd like to do process right now. And I say, do you notice? And I sequence how, and then highlight, and I say, do you see that? And usually it's very obvious. I'm not going to swing for the fences on something like defense mechanisms. I'm going to try to just get a base hit.
Yeah. So you notice every time we talk about your dad, you make a joke and you change the subject.
Yeah, exactly. That's sort of oversimplified, right? They don't come totally dressed like that, but yes, exactly. Then once it's clear that they see that, then I introduce the concept. I say, that's what we mean in pop culture when we talk about defense mechanisms. We have layers of defense mechanisms inside of us. I see it as like a bullseye, right? And sort of the ones that are going to be super obvious and frequently used are kind of the ones on the outside. And then as you get closer and closer to whatever kind of your core thing is, and I think everybody has a thing or things that they kind of orbit around, the defense mechanisms are going to become increasingly more robust, almost desperate. It's where you're going to see denial, you're going to see more primitive modes of protecting yourself. And then once they see it, you can really start to have a conversation, and you can begin the arduous process of observing that it's happening. But that takes a while. Observation really it's arguably the most effective mode of long-term change, but it's not a hack. So you're going to observe. I wouldn't try to stop them at all. I never suggest, you should try to stop doing that ever. Would never suggest that. You just observe. That happened again.
It's an indication that something's going on within the person that they want to become more aware of.
Yeah, and it's an indication of usually you're going to find an injury, some sort of psychological injury under there that's been guarded, successfully so. That's why it's unconscious. So yeah, you're going to not try to stop it. You're going to observe your patterns. You're going to begin to understand why it is that you use that particular defense mechanism in that particular instance. And then over time, you start to get the capacity to actually decide whether or not you really need to protect yourself from that feeling anymore, or if you can allow yourself to have the feeling. I see it as reintegration. Defense mechanisms keep us disintegrated from the full experience of our emotional and psychological world. And that is neither good nor bad. It just is. This is how we start to heal and reintegrate with our emotional experiences.
So you mentioned one thing I want to come back to that was interesting, the idea of modeling defense mechanisms by parents or caregivers, which you call intergenerational. What is meant by that?
You'll see in families, I certainly see it in mine, both the one I created and the one I came from, you'll see that there's styles of coping that sort of emerge over time, and you kind of all share them. 0 to 5, we have language by 5, of course, but at 5, you're starting to get more kind of like really robust language. But say 0 to up to that point, language is non-existent or it's patchy at best, right? The way that you're absorbing things at these deepest levels are sort of all through modeling and observation. And these tentacles run deep. They shape us down deep, where we see, really, you can look at family trees. This is why in every grad school across the country, everybody's at one point or another had to do their family genealogy tree, because you're actually looking at trends that emerge throughout generations. Once you can sort of see that, you can start to link together what were the dynamics going on inside of the home that required all of the inhabitants to develop this strategy of coping. And they are, again, morally and ethically neutral. We're not always just looking for how screwed up you are. There's a lot of defense mechanisms that are really successful.
Could you give us maybe one example of what might be going on within a family, like a shared defense mechanism style that might be transmitted from caregiver to child?
Passive aggression is one, but all of them. Denial, sublimation,
well, I'm wondering,
humor.
Yeah, I'm wondering, something that I see fairly frequently, and I'm wondering this might be an example, is sometimes I have a lot of patients who talk about how it wasn't safe to air the family laundry, so to speak, that the parents did not want the community and people around them to know what was going on inside the family. So they would put on a really superficially happy face out in public. Everything was perfect out in public, but at home, things were a mess.
Yeah.
And so the child sort of learned to be able to present himself or herself publicly, very calmly, collectedly, not show any emotion. But inside, there's a lot of turmoil going on.
Yes, and you have to deploy defense mechanisms to manage all of that turmoil. Right.
The affect, I'm feeling the affect out in public, but I can't allow that to
Yeah.
happen. So I'm going to find ways to taper that. Make
so
sure.
at the surface in that story, if it's conscious, it would be suppression. If it's unconscious, it would be repression, right? So there's a defense mechanism, but you're also going to see denial. There's just flat out denial.
Well, see, now we're getting into the defense mechanisms, which is the juicy part.
Yes.
So let's just start talking about them, okay?
Okay.
And
Yeah.
we've come up with a list here. I'm sure there's lots of others that we may get
I mean,
into.
they're endless.
They're endless. I know. So we're
so fun.
it is fun. I think that's
For
what
us.
we were talking about a few months ago, how fun this would be. So we're
Yes.
here.
Yes.
So let's talk about denial first.
Let's do it.
What is denial?
So denial is a really effective and commonly used primitive when we talk about the developmental origin of it. It's available to us very young. The brain does it young. So it's sort of like a shape-shifting of reality. It's a self-deception to protect you from intense feelings. In the article, I give the example that I think is effective because it's extreme. I say that, my mother basically died of denial. She died technically of colon cancer. That's certainly what her autopsy says. But the reality is, in the wake of her death, what we discovered is that she had like 16 months of doctors, Eastern, Western, all of them, telling her to like go look at these symptoms more. And she was, using the practice of like very well-intentioned, I guess, like spiritual healers. And none of them seemed to catch that she had a 9 by 3 inch tumor in her colon. And it was really a form of denial. It was really clear to me once that the enormity of that story emerged. I always knew my mother dabbled with primitive defense mechanisms like magical thinking and denial. And we all do at some level. But this was really just a clear example of how like it was her own fears around her death and loss and leaving us, and that she just in totality just denied what was happening. And that happens to greater and lesser degrees in lots of domains in our life.
Well, there's a lot of like horrible things that if we were aware of, they would be very disturbing if we were thinking about them all the time.
All the time. And they would be, that's how it's part of our adaptive unconscious, right? When we think about our defense mechanisms, they are a component of, and this is an important piece to realize about our unconscious. It's not like mystical and magical, and it's also not a receptacle for like our darkest drives, it turns out. It's just adaptive. It's part of our efficiency efforts.
Denial as a defense mechanism protects us from just becoming overwhelmed by fear and anxiety. So we have a way of seeing things that are happening to us in the world as like, it's really not that bad, or it's not going to happen to me. Things are not going to be so bad, and I'm just going to not really pay attention to it. But on the other side, if you're not getting medical treatment you need, you're not addressing something
It's denial, especially
denial.
when the symptoms are creeping up and up and up, right? So reality is pressing in on your consciousness, and yet you are keeping it at this very primitive level, completely sort of denied from your truer self-awareness.
We talked about passive aggression, and you brought that up earlier.
Yeah, people, I think, misunderstand this one all the time.
Yeah, explain it to us.
This is definitely one that's like cultural as well. And a lot of these defense mechanisms are. But passive aggression is when you have negative feelings. Negatives in air quotes. It doesn't mean they're bad. They're just negative. So anger, rage, aggression, frustration, resentment is a big one. So you have these negative feelings, but you express them through unassertive means: stubbornness, procrastination, silent treatment, pouting. And this is how passive aggression, sometimes you'll see it with like, when somebody gives you, think it's a compliment on the surface, and then you're like, I think, like it's like a bit of a jab at the same time. These are all ways that people try to stay very distant from feelings that they have deemed unacceptable. And by they, it's in air quotes because these are all time travelers. So they're not crazy. They got messages growing up that these feelings were bad. They're doing what the fine print on their contract
It wasn't
told them to do.
It wasn't safe when they were young to express
Yeah,
anger,
it's not
frustration,
psychotic.
anxiety.
It's not perceived. It's
Yeah.
real.
Yeah.
Yeah. And
So they had to find some way to express themselves in a way that wasn't being direct with those emotions.
yeah, I often see passive aggression as this, like, it's often bundled in with power struggles. You'll see it in kids, right? They're pissed that you're making them brush their teeth, so they'll make the teeth take 30 minutes, right? So you see these ways that they're trying to work out that they're angry at you, and they think you're a nuisance and irritating, and they think this is stupid. And so they'll, drag their feet, they'll procrastinate. I think there's developmental power struggles that you'll always get in, and defense mechanisms will surface. It's whether or not they get fixed.
Yeah.
That's the key, right? Everybody uses a smattering of all of them all the time. But when we see that there's really fixed patterns, and by the way, everybody's got them, that's the horror of being human, then they're worth looking at. I mean, if you land in our office.
So somebody is coming in, they have a tendency to be passive aggressive. They're probably having troubles in their relationship. They can't express how they feel because they don't feel safe doing that. So they engage in behavior that's confusing and frustrating to their partner. And part of it is they're using this defense mechanism in a way that's not helping them.
Yeah, and I would say that it's that they perceive it won't be safe, right? Because often in the adult relationship, it may be. Now, we get into the other component about how our unconscious shapes who we pick, and there you have it. Sometimes we have a lock and key fit with kind of, actually you land in a relationship where it's not safe.
Well, you were talking about that a little bit in the Power of the Unconscious episode. That's right.
Right.
But assuming it's a healthy
Yeah.
relationship and a healthy partner,
Yeah.
that defense mechanism of being passive aggressive isn't helping that person connect with their partner and get their needs met.
Yeah, and when you're doing couples and group work, you're often looking at the group level to make sure that, okay, is it safe?
Yeah.
Is this a perceived lack of safety? Or in fact, is it a mutually parasitic dynamic that in fact it's not safe? And then can they shift that long-held interpersonal dynamic? We're talking about the intrapersonal, you inside of you, right?
Yeah. How about projection? That one is one that we see pretty frequently.
Yeah, we do see that very frequently. So projection is when you have this unconscious or you have this discomfort. It's usually unconscious completely around feelings. And so what you do is you attribute it to somebody else. So you're angry and frustrated. And so you come home from work and you unconsciously manipulate the dynamic so that then your spouse expresses frustration. You're like, I don't know what's wrong with you. You seem so frustrated and angry. You've essentially you've projected it outside of yourself because it was so uncomfortable for you to feel. And it's really maddening when it's effective.
So the person who is projecting, are they poking the other person to get angry and then say, you're angry?
Often.
That often happens.
Often. And that's all unconscious, by the way. They didn't go in saying, you know what I'm going to do?
Yeah.
I'm going to go start a fight and then blame him or her for the feeling that I feel.
It wasn't a premeditated
No,
plot.
right, exactly. If we're giving it like first or second degree manslaughter, or, it's not first degree. There's no intent.
What about guilt and shame in a context of projection as a defense mechanism?
Tell me what you mean.
Well, so somebody feels guilty or they have feelings of shame. How might they project that onto another person to elicit a response from them?
Well, this gets into a very important topic, which is that projection often leads to these sort of secondary things, right? So I think that it's that the projection is trying to protect you from your own shame, right? And then you are projecting it on to somebody else. That's how I generally see it. Is that what you were talking about?
Yeah, I think so. I'm thinking about the person who maybe they feel badly about themselves. They feel ashamed about some aspect of themselves, and they don't want to feel that.
Yeah.
So they may end up beating up on the other person or putting them down, basically blaming them for the very things that they themselves feel about themselves.
Yes. Yeah. So like the classic case is like you'll have somebody in a partnership who's struggling with infidelity, and they become increasingly paranoid that the spouse is cheating. So that's how I always see it, sort of kind of like pupates into these other tendencies. But the other tendency is, so like you'll be like, oh, he or she seems paranoid. But when you really trace it back, it's projection.
Yeah. Well, I'm thinking of also a similar thing to that where one partner blames the other partner for, you don't really love me, you don't really want to be with me, you don't care about me, where the first person is really struggling with their own feelings about the
Yes.
relationship,
Yes.
about how they feel about themselves in the relationship.
Yes.
So that'd be an example of projection.
Yes,
Yeah.
exactly. Yeah. Those ones are much more subtle, right? So you have to, you have to really pay attention to it. But projection is everywhere. I mean, it is everywhere. People are constantly, and then we have this other thing, projective identification, right? And so the projective identification, for anybody listening who's still interested in our geeky deep dive, is
I'm
when
interested.
so am I. Even if we have an audience of
Right.
two,
That's right.
we're very content.
Well, if you can only reach two people, right?
Okay. So projective identification is when the unwanted feeling is projected out, and then the other person identifies with it and sort of takes it on, right? And so as therapists, we're always looking out for projective identification. You're always trying to bob and weave. But projection it's maddening, by the way. It's a as the recipient of it, it's like you feel like caged in somebody else's interpretation of you. It's a little bit crazy making. You're like, how did this happen? That's often the indicator when I'm listening to hear if somebody is the object of a projected. I'm often listening for those kinds of cues.
It's confusing for that person because they're basically,
Left out of the memo.
yeah.
They know the other person is keeping the feeling on. Remember, the key word was it's unconsciously undesirable feelings, right? And so there's no memo, by the way, I'm projecting onto you. Forgive me. It's just all of a sudden that you're caged in this perception that doesn't feel right to you, doesn't feel like your reality.
Yeah, I mean, I imagine in a relationship that often looks like a person being blamed for things that they feel have nothing to do with them. Like, wait, where is this coming from? Why are you telling me that I'm this, and that when that has nothing really to do with me? I mean, maybe sometimes it does. I mean, sometimes in
Well,
relationships.
even a blind squirrel catches a nut sometimes.
Yeah, right.
Right? I mean, sometimes
Yeah.
you're right. Yeah. But not as often as the projection has it be. And you see these really fixed patterns where,
So how about reaction formation?
yeah, so this gets into like our deep Freudian roots, right? Like this was sort of started by him. But yeah, reaction formation is when, again, a feeling is unacceptable to yourself. Now, we've already covered that it may be real or perceived in actuality. And we've covered that the way it became unacceptable is through decades of modeling and the environment shaping you, right? You didn't just make it up that it's unacceptable. It's very likely that at some point in your life it was. So instead of accepting it, you do the absolute opposite of it, right? So this is a really good example developmentally. Like you'll see it with kids when like a new sibling enters, right? And there's like lots of jealousy. And instead of like smothering the baby, the sibling goes up and like hugs and adores. And sometimes they feel hugging and adoring, but oftentimes you'll see that they're really sort of trying to shift this other feeling into the exact opposite. It's one I see that I pick up on the least. I don't know if that's because the frequency with which it's used is less than some of the other ones, right?
So these feelings that I'm having about some aspect about myself are so unacceptable
They
that
cause so much stress and anxiety.
so much stress and anxiety that I want to do the opposite.
This is probably behind like a lot of like health fads, right? The feelings of being unhealthy and worrying about your death leads you to go on this crazy health fad. You know, so I think like we see that a lot currently in people that are having like transformation.
So do you think, like, as adults, people who endorse or engage in something to an extreme degree, we might be looking out for a reaction formation
Or sublimation.
or sublimation?
Yeah, totally.
What's the difference?
Agreed.
What's sublimation? Let's talk about that.
Okay, so this is one of my favorites. So sublimation and humor were considered sort of like highly evolved in terms of developmental origins, defense mechanisms. So it's unacceptable urges are turned into something also emotionally healthy. So the old adage that like behind every shrink is a voyeur. Okay. Behind surgeons are somebody who was like dissecting animals in the neighborhood, right? Like
Or worse.
or worse, exactly like I have written here in my notes. Let me just, now that you opened it. That someone who enjoys dissecting animals as a child, which is an indicator to become a serial killer, becomes a world-renowned surgeon versus a serial killer, right? Or like prison wardens,
Yes.
right?
And disclaimer, we're not saying that
We're not.
surgeons are really sublimating their need to be a
Murderous
murderous, but
Yeah.
right.
Right. But these are examples of that, right? And I'm certainly somebody who really identifies with like, I just remember being like 7, 8, 9, 10, 11 years old and just being nosy. Just literally wanting to know like the deeper inner workings of people, and then like found a way to make it a career.
So sublimation, the way that we're talking about it, sounds pretty positive because you're
Yeah.
taking a uncomfortable feeling or something about oneself that might be unacceptable and turning it into something that's healthier or better for that person.
Yeah. Whereas reaction formation, I believe, is considered a more primitive defense mechanism.
Yeah, and I've always sort of wondered, like sometimes I talk with my LGBTQ patients about
Yeah.
people who tend to be really homophobic, gay bashing types of people,
Yes.
and wondering if maybe they're struggling with
Right.
uncomfortable
Then you find
feelings.
Grinder on their phone. Is that where we're headed?
That's sort of where we're headed, right? So the idea that in one's personal sociocultural upbringing, something about themselves that might be very uncomfortable
Yeah.
to them gets turned into something
Yeah.
that's more acceptable to them on the surface level, but it's protecting them from something more uncomfortable underneath that.
Yeah. And I guess, too, if we sort of flipped that around, that somebody struggling with, say, sexuality development might, like, let's say they're struggling with feeling that they may be homosexual, that they may act promiscuous heterosexually, right? Do the exact opposite as a way to maintain obscurity.
Right.
Yeah?
Yeah. Okay. Got it. So sublimation, that sounds healthy in some ways, but I could also see how as a defense mechanism that could, if something's done too much to an extreme, it could be unhealthy to a person and they might be avoiding deeper feelings to them that might be important for them to deal with.
Yeah, I think using any of these defense mechanisms, again, that rigidity, that to the exclusion of other strategies, I think you want to try to have a diverse bench. You know, a little bit here and a little bit there, never hurt nobody. But yeah, I think if you're using it to the exclusion of anything else, then you're not gaining access. You're not getting integrated, reintegrated with the feelings. And then you really do see people who they might be enormously successful in, let's say, their career. And yet every other pocket of their life has suffered. They haven't been able to hold a relationship together. They haven't maintained a connection with their children. I think you have a pretty good indication there. That's sort of like sublimation gone wrong.
Yeah, so the defense mechanisms are really helping them achieve something that they can be proud of as an achievement, but
Yeah.
wrecks
And-
other parts of their life.
Yeah, and the achievement is really obscuring areas where they actually feel quite inferior.
How about rationalization?
Rationalization is when you have provocative feelings like we've been talking about, and they're explained away by a neutral logic. So the classic example would be you're passed up for a promotion at your job and you sort of rationalize it as like, well, I didn't really want it anyway. And it's effective as like a quick pass off, right? But the more you do it, the more you have to do it. because it's literally just excusing away the feeling. It's like the feeling sort of peeks its head out and you're like, nope.
So the person who would say that, say they were passed up for a promotion and rationalizes it away, it makes them feel a little bit better in the moment.
I don't know if it makes them feel better, but it doesn't make them feel worse.
Okay, right.
Yeah.
They're not feeling the feeling of feeling
Exactly.
disappointed,
Exactly.
feeling worried about
Totally.
how are they doing.
What are the optics? Why did I get you get to bypass all the what we think in our world, right? Is that you're skipping the stuff that's critical to becoming a whole person,
Yeah.
a whole emotionally flexible person.
So that person who is rationalizing in that situation, therapeutically, why would it be helpful to examine that defense mechanism, the rationalization in that situation?
For many reasons. First of all, it's always useful to observe, right? Because if you're rationalizing it, then odds are you're protecting from something, right?
You could end up rationalizing a lot of things in life
Everything
and being
away.
hurt, not getting what you want.
Yes.
Yeah.
Yes, exactly. Also, over and over rationalization, like a repeated use, you'll often see it paired with people that also sort of don't take accountability for what's going on in their life. They just kind of quickly start rationalizing everything. So they're often missing the opportunity to also self-improve around like, okay, well, there's probably tangible things that resulted in not getting the job. And if we can't get to that you actually did want it, if we have to stay in the fairy tale land that you didn't, like, why would you apply for it, first of all?
Yeah.
And secondly, we can't then help you better come up with strategies of like, so maybe you go talk to them. Hey, where did I fall short? I really wanted, felt I was a good candidate. So you can't self-improve in any way.
I kind of like where you're going with this because it reminds me about how important emotions are and how important the emotional experience is to us to be kind of like a warning signal that there's something for us to pay attention to.
It's a mirror.
Yeah, and the rationalization is a way of doing away with that, getting rid of that warning signal.
Yeah, and it's like a quick and dirty one. You can sort of do it with very little cognitive load.
Yeah, I didn't want that job. That was a stupid job.
fuck
Those
it.
people were stupid.
Yeah.
Like,
Yeah.
and that. And then you're saying that after the 5th job interview,
Yes.
Where you came,
And by the way, you can say it with relation. I wasn't that into her or him.
Right.
It wasn't that good anyway.
The last couple of times there were just women who I couldn't stand anyway. So
Yes.
why even bother going?
Yes.
Because, they all kind of suck. And,
Exactly.
And then, 10 years later, you don't have a relationship.
Yeah, exactly. I think that one's like, if we think about it, Pavlovian, it's like you have to keep pressing the lever to get the return on investment. And it's also rampant everywhere. You're going to hear people, I almost feel sad, anybody listening to this, it's like, you can never unknow this. Now they're going to walk around with what we have in our head, in their heads.
Right.
But yeah, rationalization, I think it's effective probably for short-term things like you get news and then you have to go perform. Like, great, rationalize, get the performance done, whatever it is. And but eventually you have to sit in the experience that, it was disappointing. You didn't feel good about it. You felt overlooked. You had imposter syndrome. You feel insecure.
And rationalization, let's just say clearly, is different from being rational.
Totally different.
Okay. Rationalization is the defense mechanism we're talking about. Being rational is just looking at evidence and data and coming to conclusions that are helpful for you to know what's going on.
Yeah, and highly subjective and all of that too.
Sure.
But yeah, rationalization is just using a neutral logic to de-intensify the experience that you're having.
Yeah. Okay. So intellectualization, what's that? It's similar to rationalization?
Yeah, I think sometimes they come clustered around, but this one's different. This is where reason and logic are used to block any confrontation with difficult feelings. So you'll see this, I think probably everybody that's gone to grad school has snuggled into intellectualization. This is, if anybody's wondering, who's somebody that uses intellectualization? Me. The type of rational thinking you were just talking about, not a neutral logic. Oh, I didn't want that job anyway. It will be like you absorb yourself in a topic to stay away from the feeling
right.
of something. So you become, you can talk about it at this intellectual level. And yet there seems to be this other level where you're blocked off from it. I spent like a decade in therapy untying the knots of intellectualization. And even now, when I am overwhelmed in life, that is my go-to. And I see it like if I'm writing about something and I feel like when I'm making edits to my writing, I'm always looking for sort of 3 layers that I go through, right? Grammar is one, ease of reading, and then I try to look at, okay, what's the idiosyncratic way that you communicate when you're off balance, when you sort of don't feel, usually for me, it's that I'm not fully informed on a topic and I see intellectualization in my writing. It's just too dense. It's still, the remnants are there. I was probably a kid that like the facts made me feel safe.
Yeah, I could see how writing could be a form of intellectualization, because instead of feeling something, you end up writing about it, but in an intellectualized sort of way. Oh, these people who do this, they're bad, and these are the reasons why, and this is what should happen to them, rather than acknowledging these people did this to me and I feel really hurt by it.
Yeah.
So intellectualization sounds like a way to distance oneself from one's emotional experience.
Yeah, it's a thinking versus feeling strategy in life.
Yeah. So how about dissociation?
Yeah, so dissociation is a big topic. I mean, we could do a whole day on dissociation because it taps into so many other realms. It certainly taps into the unconscious. And dissociation is something that is often associated with trauma, real sort of like capital T trauma, right? And dissociation is when you are psychologically and cognitively sort of removed from the experience that is happening. It's the ultimate expression of our unconscious. The actual memory is removed from your conscious thoughts. It's always paired, or it's usually paired with like a depersonalization, right? You sort of have this feeling, it's not fully happening to you. But it's a more, when we talk about those developmental origins, dissociation is a defense mechanism that I look for because it's usually pretty diagnostic. You're going to see some other cognitive features that get paired.
So dissociation, you're talking about trauma with a capital T. So you mean like a person experiences trauma or something that's just way beyond what psychologically and emotionally they can handle, and they learn how to distance themselves from their feelings by just stepping outside themselves.
Yeah, vacate the premise.
And that's very effective at the time.
Enormously effective.
In fact, the mind has to be able to do that because what's going on in the traumatic experience are just so awful.
It would kill you.
Yeah.
Yeah, it's really one of those defense mechanisms where you are humbled by what the brain and the mind can do outside of your own awareness. It's just, you just realize like, oh wow, we really are mostly unconscious. And it's life-saving. It usually comes home to roost in episodes of highly intrusive, intense feelings, whether it's anxiety or deep depression. And sometimes you're going to then find these repressed and dissociated memories kind of start to patchwork themselves back together. This is where EMDR becomes an enormously valuable therapeutic tool to help people better regulate at that central nervous system level, because it's those feelings that were completely locked off to you are incredibly disruptive upon reentry.
So a person as an adult starts to feel anxious, starts to have feelings that are reminiscent of the traumatic experience, and the dissociation defense mechanism kicks in.
Yes, and if it doesn't, you really see these eruptions in intensity.
What about repression? You mentioned that a few minutes ago.
Yeah, so repression And suppression, I always think of sort of one is conscious and the other isn't. So suppression is like, I don't want to think this. I'm not going to. Also effective sometimes. Repression is unconscious. You aren't consciously repressing it, but it is out of your emotional sightline. You don't have awareness of it. And it's also, when it's effective, it's very effective.
So when repression, are we usually talking about memories?
Yes, right?
Yeah.
Yeah.
So repressing memories, not being able to remember things that have happened in the past that unconsciously we can't deal with.
Say it again.
Not being able to recall memories from the past that we can't deal with.
Yeah.
Emotionally.
Exactly. Yeah, exactly. It's not that you're necessarily, although the feeling could be the trigger, right, that makes you rely on repression, but you're repressing memories. That's why it's always associated with the unconscious.
Yeah.
Always. Because remember that we're processing 11 million pieces of information every waking second, and 40 of them make it to consciousness in any 1 second. I could name 40.
Sure. We talked a lot about that in the last
Yeah.
episode,
Yeah.
all the different ways that we're chugging through life.
Yeah, we're just chugging through life. And so repression is always involved because it's working with our working memory, right? That's why I bring up this piece of it, is that it's always in partnership with our working memory, which is very limited, 7 to 9 items.
Let's talk about my and probably your favorite of the defense mechanisms, which would be humor.
I mean, where should we start?
Right.
Right? Yeah, I mean, this is why often, there is that old adage that behind every great comedian is sort of a tortured soul. And there's very few exceptions to that belief. And this is why that exists, right? Is that it turns out that humor is really one of the most effective and most developmentally mature styles of coping with pain and intensity. That's why, there is a darkness in really brilliant comedic shows, right?
Well, a lot of comedians are making fun of themselves.
Yeah.
It's embarrassing things that they did, shameful things
Yeah.
that have happened to them, and kind of making fun of them.
Yeah, and they're finding irony and sarcasm means flesh tearing. So right there you can sort of
Wow, is that true?
It means flesh
Wow.
tearing. Yeah. I think it's true, but now all the linguists are going to come out of the just email us if we're wrong.
Well, psychology people are listening to this, not linguists, right?
That's true. Also, I think when you go to a really good comedy show, it's uncomfortable for a reason.
Yeah.
Right? It's uncomfortable for a reason because it's tapping in unconsciously down to these areas that we're all so defended against.
And comedians know that. They
Oh,
sort
yes.
of know on an
They're-
instinctive level what makes people feel uncomfortable
Yeah.
and how to tap in it in a way that's just uncomfortable enough to be funny, but not too uncomfortable to send people out the door.
Yeah, and it's the loneliest place in the world, right? I'm a huge Howard Stern fan, and he interviews comedians all the time, and it's he says, it is literally the loneliest place, right? Because you're playing with all those levers and widgets inside yourself. By the way, you have first gone to the darkness in you, and then you've come forth with this capacity, you're saying, intuitively. And I think for a lot of them it is intuitive, and then I think they practice the craft.
So therapeutically speaking, we don't want people to do away with their sense of humor or their comedic style, right?
No.
But there is a benefit to understanding how humor works as a defense mechanism for people.
And also it taps into this sublimation thing, right? We said before, it's great to be a world-renowned comic and have amazing art out there, right? Because it's an art. But if it's to the exclusion that you're the best in the world and you're doing the best comedy shows and you sold out Madison Square Garden, but you can't hold a relationship, you can't have any depth in your life. A lot of times you'll find comedians with substance abuse. It's all trying to dampen down the elements. So I think you can work on, as a funny person, you can still be incredibly, in fact, I'd argue you'll be an even better comedian. You can be incredibly emotionally integrated and have metabolized why you use the humor and still be enormously effective at your craft.
Yeah, I could imagine a funny person. Maybe they're not a professional comic, but just a person who uses humor as a defense mechanism could be constantly cracking jokes and making light of things in a relationship. And that might be very unfulfilling.
Maddening.
Yeah, it could be
I
maddening.
mean, it's fun when it's fun, but then an adult relationship requires that you have that dexterity to also be able to be present in the difficult things in life.
Yeah. Sarah, any final thoughts or advice on this subject of defense mechanisms before we wrap up?
I mean, nothing in particular, other than that I would really want to drive home for people to see that we all use them. They're universal. It's just part of our efficiency efforts. And that it's really like a fascinating place when you get into the game of self-awareness. It's fascinating and helpful to understand how you are operating in this domain, because we are, all of us.
Sarah, thank you so much for coming on the show once again.
Yeah, thanks for having me.
And I hope I can have you on again. I
I'll
think
come
this should
anytime.
be a regular thing.
Yes, I agree completely.
Great. Dr. Sarah Sarkis, clinical psychologist. Thanks again for being here.
Thanks for having me.
Thank you for listening to Mind Tricks Radio. I hope you have enjoyed the program. For more information about Mind Tricks, please go to my website, www.waikikihealth.com. Please be sure to subscribe to Mind Tricks podcast and accompanying blog to be notified of new episodes of Mind Tricks. Please be sure to follow Mind Tricks on Facebook by following and liking posts by myself, your host, Dr. Aaron Kaplan.